Good afternoon, everybody. I am Sania, your host from today's live from All About Skin Wellbeing team. I am sure all of you must be keeping good health. Today, we are going to discuss about skin health with focus on psoriasis. Psoriasis is a condition in which skin cells build up and form scales, itchy and dry patches. Psoriasis is thought to be an immune system problem. Triggers include infection, stress, and cold. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints as well. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 and 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing we can get to hear from an expert dermatologist online about psoriasis and its type, how we can prevent it, and the kind of tests which are required for its diagnosis, the right treatment, and the management approach for an early relief. So, ladies and gentlemen, girls and boys, today we have with us a renowned dermatologist of India, Dr. Kavitha GV Mandal. She is a skilled and experienced dermatologist, trichologist, pediatric dermatologist, cosmetologist, and a hair transplantation surgeon who is dedicated to helping our patient achieve healthy, beautiful skin. Practicing dermatology for more than 20 years now and has deep understanding of the complex and varied needs of our patient, and she's committed to providing personalized care to each and every one of them. Also practicing dermatology in SK2 Derma at Bangalore, Stalford Road, near Wipro office. A very warm welcome to you, Dr. Kavitha GV Mandal, and it's a pleasure to have you us here on today.
Hi, thank you. Thank you for my introduction. Hello, everyone. Good afternoon. I am Dr. Kavitha, practicing board certified dermatologist at Sarjapur Road in my home clinic, SK2 Derma. I've been practicing more than 20 years now. Today we have a wonderful session regarding psoriasis. So let us talk about psoriasis and make our audiences to understand more about psoriasis.
Yes, definitely, doctor. And as we are going to discuss about psoriasis, and as you know, I read in the introduction that it is between the young age of 20 to 30 years, and is equally in men and women. But in if we understand that what is basically psoriasis, so how we can define it?
See, psoriasis is a chronic skin condition in which the skin cells start building up to form a reddish, itchy, powdery, white, scaly rashes, more so commonly on knees, elbows, lower back, scalp, and sometimes even on palms and soles. And very rarely, even nails and joints are also affected.
Okay, so is it like that? As you have mentioned, in nails as well. Is it like that? There is a particular season of it, like as the monsoon have already hit India. So is it like that? The cases are more in monsoon season.
Yes. Of course, like psoriasis come under dry skin disorders. We get, in my office, I get a lot of patients with psoriasis in winter season where the weather is cold and there is lack of humidity in the weather. Yes.
Right. And as we are moving toward the topic, what are the causes, doctor, if we can discuss about what are the various causes if somebody need to identify that due to particular thing, I got psoriasis. So what is the causes of it?
See, psoriasis per se, the exact reason is not known. It comes under autoimmune disease where there is a problem in one's, like the autoimmune system. So the exact reason is not known. So for some reasons, for some, like various triggering factors, the immune system, produces lot of skin body cells, and it produces lot of skin layers to pile upon and where we see as psoriasis. But there are certain triggering factors like one has to watch out, like exposure to certain infections, especially sore throat, upper respiratory tract infections caused by streptococcal infections, ear infections, and any factors which reduces one's immunity, like physical stress, mental stress, and excessive usage of tobacco, alcohol, and like exposure to cold, dry winter weathers, and like where the one person's environment is fully, like they stay, few people stay in indoors where there is absolutely no humidity, like the dry indoor atmosphere, heated, like rooms, and even exposure to, exposure to a lot of other things like medications. So few people will be taking some medications like corticosteroids, lithium, and antihypertensives, like beta blockers and so on, like it's more of like triggering factors.
Okay, so is it like
And
that?
especially, I'm sorry to interfere, and especially when once some, like there is a cut in the skin or trauma, or, like a scratch also triggers, like the psoriasis lesions will trigger on this, the scratch marks or a cut marks or a trauma to the skin, and or an insect bite reaction, and even excessive dry skin might trigger this condition. Yeah.
Okay, so is it like that? The triggers are and the causes are different in different people.
Yes, yes, of course. It depends upon one's lifestyle, dietary factors, atmosphere, and the weather they live, everything. And some very less few people have even genetic history. Like 10 to 20% have genetic history also. The people who are having, first degree relatives psoriasis are more prone for psoriasis. It's like that.
Okay, and as you have mentioned that it can be genetic as well. So is it like that? If someone has a history of psoriasis in their family, they can definitely, get
Not
psoriasis.
definitely, not definitely, not definitely. Only 5 to 10% chances, and only when they have first degree relatives. Not everyone. We can't predict, but we can't predict who gets psoriasis, who not. It's very rare chances. Yeah.
Okay, so is it rare that it can pass it on to
No,
the
no,
generation?
no. Need not be. Need not be. Very less chances.
Okay, very less chances. Doctor, when we are talking about psoriasis, is it like that there are, some types of it that somebody can definitely identify? Like how a person can identify quick that, this is the symptom of psoriasis and they need definitely, not treat them themselves and they need to
Yeah, the
go to a
person, like
dermatologist.
the person observes, like itchy, scaly, flaky lesions usually develops. Common sites are like elbows, knees, and sometimes they feel like excessive dandruff on the scalp. Like, but not, it's not dandruff. You have to go to a dermatologist and get checked whether it is a dandruff or psoriasis. It looks like very severe form of dandruff, but not dandruff. And even one can feel, like itchy lesions on palms, soles, and very rarely, even their nails also would be affected, and very rarely even the joints are also affected. One might like experience joint pain, stiffness, and swelling, but that is in the rarest of the rarest cases, and also depending upon the severity of the psoriasis. But initially one should watch for these rashes, this silvery white scales on knees, elbows, and sometimes lower back, and palms, soles, and scalp, more so of that.
Okay, and usually what people do, they usually ignore it that, it will gone in 2 3 days
Yeah,
and
people,
some.
like usually ignore, and they apply their own on-counter medications. Like maybe they try like coconut oil or liquid paraffin, or they go to a pharmacy and, like get their own, on-counter products and start using. Especially commonly, they use these steroid ointments, which is not under a doctor's supervision, which is not good. And they might be, like the pharmacist might also give of irritants like salicylic acid, coal tar preparations. So all these are like, they should be used under a guidance of, dermatologist, but not, the self medication is not safe because there are many other complications associated with it.
Right, and as the doctor already mentioned, that self-medication is not the best treatment for
Yeah.
psoriasis. So next time you see any kind of symptom, go to your nearby dermatologist. That is what the doctor also suggested. Doctor, as we are talking about psoriasis and we have discussed that it is itchy rash, sometimes we see so many people around us or our friends, they are like they have it burning sensation, but they don't go to a doctor, and sometimes we are far away from them. That so is it like that psoriasis is contagious or it is not?
It is not contagious. It is just, like a chronic skin condition. It is not contagious. But yeah, people should take care early and adequate treatment and go to a, like approach a dermatologist, and early and adequate treatment will, definitely help the patient to reduce the symptoms and avoid further complications.
Right, so it is not contagious, but if you
Definitely,
or
it is not contagious. It is not transmissible.
it
Yeah,
is not
it
transferable.
is not
Okay.
transmissible.
So at any other point of time, if they see some of their friends or they are having some symptoms, they can definitely go and refer to a dermatologist.
Yeah.
Doctor, when we are talking about symptoms, also how are they treated? Like, are there any different methods of treatment which are available for it?
Yeah, there are many modes of treatments available these days. Each treatment is different for different, like patients. It depends upon the body involvement also. So, like, let us take like if the body involvement is less than 20%, the modality will be different and mild. And if the body involvement is more than 20%, the modality changes according to the symptoms and the other things we have to take in consideration. Yeah.
Okay, so there are different modes of treatment for different people or
Yeah. The
patients.
treatment is completely, like unique and different for different patients.
Okay, and does this happen in your clinic as well? Sometimes the people
Yeah.
self-medicate, they go to the
Yeah.
medical
In India,
store.
especially in India, it happens, like people would have already started a kind of, like on-counter products, especially very potent topical preparations like steroids or salicylic acid, coal tar preparations, which are irritants on the skin, or even oral steroids, and they stop abruptly, and they come with withdrawal effects of all these things as a flaring up of psoriasis. They come to our office, and this is the commonest scenario in our country. So it all happens because when the patient is not aware of self medication is dangerous, or they follow some on counter products, which I really not it's not advisable.
Right. And sometimes, doctor, people also apply home remedies.
Yeah.
Some of their friends or parents suggest, that you should apply coconut oil or something else, and they
Yeah.
apply. So, how effective is the home remedies for it?
Home remedies, coconut oil is actually, like I'm not telling they can't apply coconut. Coconut oil comes under a good emollient. They can apply as a moisturizing, like a emollient on the skin. It helps to hydrate the skin. Up to like coconut oil is fine, but not other preparations like, other irritants, no, not advisable. Coconut oil is fine, and liquid paraffin is fine, because psoriasis comes under a dry skin disorder where a patient is always advised to keep their skin well. The skin should be well hydrated with good amount of emollients, moisturizers, and also coconut oil is fine, but not apart from that. I don't really advise anything. Yeah.
Okay, so if you want, you can definitely, you can apply coconut oil, but
Or
it is
any other,
better.
yeah, vegetable oil which suits them, like sometimes other oils might, if they come to know they're allergic to it, they develop rashes, definitely they have to stop it. Yeah.
Right. And doctor, is it like that if somebody is having, a healthy lifestyle, or and if
Yeah.
one person is not having such a healthy lifestyle, they don't eat vegetables,
Yes.
they eat more of junk food. Does it can also be a triggering cause for
Yes,
psoriasis?
of course, like diet, lifestyle plays a very important role. If the person is prone for psoriasis, like diet is very important, lifestyle is very important, and stress management is very important. Like diet should be good, protein rich food, zinc rich food, and they should add a lot of fruits, salads, sprouts, and water intake should be adequate. At least 3 to 4 liters of water is very important. And lifestyle modifications are very important, because obesity aggravates psoriasis. So here definitely one should like put their routine into some kind of physical exercises, yoga, and like stress management. Everything is very very important in the management of psoriasis. So like lifestyle and and excessive like usage of tobacco, alcohol is also an aggravating factor. So a good healthy lifestyle, a balanced diet is very important for the better outcome.
Okay, so having a good lifestyle is good
Ne-
for your health as well, and
yes,
as doctor already mentioned, that it can lifestyle modification can definitely help you in curing your psoriasis. Doctor, as we have discussed about the triggering effect or the triggering
triggering factors.
triggers factors, what is that thing which can worsen the psoriasis?
See, psoriasis might aggravate on like, like if a person is having an underlying streptococcal infection, like, commonly sore throat or upper respiratory tract infection, or any other infection, the root cause has to be first, like they should be treated first. The infection should be treated adequately. Yeah. Then other factors, like, like we should ask for their other things, like other comorbidities, coexisting conditions, and are they on any kind of medications, especially when it comes to like corticosteroids or lithium, or antihypertensives, like especially beta blockers. All these are aggravating factors, so we should check all of them. And psoriasis is also associated with other autoimmune diseases like thyroid, etc. So that also has to be treated. And sometimes lack of vitamins, like especially calcium, zinc, and protein deficiency and all, also has to be looked upon. Like investigations has to in detailed investigations has to be done and corrected well, so that whatever the treatment done to the psoriasis will respond very well. So, and the patient also should be educated about taking good nutritious diet, taking care of other things and all, like lifestyle changes and all, is very very important. Yeah.
Yes, and I think all the things will definitely can be understood by a dermatologist only, because when we
Yeah.
self-treat it, when we assume it that if I'm having such triggers, or if I've eaten something this caused psoriasis, I think that is should not be done in any case. So if you are having any symptoms, go and refer to a dermatologist. Doctor, as you mentioned that all the histories, when somebody come to you, you check all the history and all. What are the organs? If we talk about what are the organs which are affected by psoriasis?
See, first and foremost, in our body, skin is the biggest organ and which is most commonly affected in psoriasis. And sometimes nails and even joints were also affected. But in very, very severe cases where there is, like more involvement, or like more than 20% involvement, like it might lead to other, system, like, involvement, like obesity, diabetes, and even sometimes heart ailments might trigger, so on, like, but very rarely we come across all these internal issues. Yeah, but more so it is affected on the skin, nails, joint involvement is also not very common. If it's the psoriasis is affected more than 20%, more than 30%, and if the person is suffering for more than 7 to 10 years, then only all these complications will come into existence. Otherwise, it's more to do with your like skin, scalp, and sometimes nails. It's like that. Yeah.
Okay, so more to the skin, like
Skin,
it,
yes,
and
yes.
it can be seen as well.
Yeah, it can be seen. So, like if it is on the exposed parts of the body, of course, even though it is not contagious, so it causes a lot of, like mentally it is affected, mentally it affects the person, which definitely, like it decreases their self-confidence, and, they might go for depression as well. Sometimes the depression is so bad, people will have suicidal tendencies also. It's not that it is dangerous, but the appearance of the skin lesions itself, the person will lose their confidence and their performance will decrease and all. So early and adequate treatment helps to reduce the skin lesions faster, and they can get back to their normal routine activities and all. So, like, treatment with a good dermatologist is very important. Yeah.
Yes, the treatment is very important. And Dr. B, discussing about psoriasis, we have some questions from our live viewers who are
Yeah.
here
Yeah.
watching this live. So there's a question that can psoriasis increase the risk of developing other health conditions? And if so, what should I be aware of?
Yeah, psoriasis increases, like diabetes and any other cardiovascular ailments. And if the joints are affected, arthritis, people will have a lot of swelling of the joints, stiffness of the joints, where it hampers their day-to-day daily routine activities. And if the scalp is affected more, like they start losing their hair, the thinning hair is one, again, a biggest cosmetic and aesthetic problem. And if the nails are affected, they don't feel good about their nail, there will be a lot of pitting and, like roughness of the nails. So all these are, like severe complicated complications are more of, we have to emphasize on obesity, diabetes, cardiovascular component, and rarest of the rarest cases, even other organs like kidneys and all are also affected. Yes.
Okay, so if you have any symptoms, please go refer to a dermatologist because it can affect
Yeah. Yeah.
your organs as well. Doctor, there are more questions from our live viewers who are watching this live. There is Rohit asking, can you recommend a suitable skincare routine to elevate psoriasis symptoms and keep my skin healthy?
Yeah, like as I told, psoriasis is a comes under a dry skin disorders. One should always, take shower in lukewarm water. Lukewarm water is healthy for everybody. Like, because hot water will have, like it affects the skin. It breaks the skin. Already, psoriasis person will be having a very dry skin. So if they take bath in very hot water, that skin will dry up more. So always we advise to take bath in, like lukewarm water. Use mild shower gels or soaps, and always don't forget to apply a thick moisturizing creams on the body at least 2 times in a day. Immediately after taking bath once and before going to bed should be fine. Yeah, and if they have psoriatic rashes, I always tell the patients to apply the moisturizer at least 3 to 4 times per day for at least initially 3 months, so that the lesions will heal well. And take good nutritious diet. Add, like a protein rich diet. Add foods rich in omega-3 fatty acids. Add antioxidant rich foods. Like, again, sleep well, exercise, yoga, stress management, everything like plays a very key important role for the better outcome and to maintain a good skin.
Right. And as you have mentioned about, moisturizing the
Yeah.
skin, is it like that there are different moistures or some content which are available for, people who are having
Yes,
psoriasis?
there are like different, like different types of moisturizers available in the market these days. And I always advise, to go for medically graded products where the, like hydration stays longer. Thick moisturizing creams are available, especially for psoriasis, like where the hydration stays longer, and they have skin friendly, ingredients, and they're quite safe for long term usage, and they don't have unnecessary perfumes or coloring agents. So like products also should be used according to the doctor's advice. Yeah.
Okay, so as doctor advice, those are the moisturizer or those are the skin
Yes, which should be mild, and also where the hydration should be maintained, pH of the skin should be maintained. like I don't really prescribe advise the patients to use on counter products when they have a problematic skin. Yeah.
Right, right. So we have discussed about the diet, play a very important role. But there's a question from one of our viewer asking what role diet plays in psoriasis management, and are there any foods I should definitely avoid or include in my diet?
See, avoid junk food, oily foods which are having higher glycemic index, and foods which have sugar, which are not healthy, because that leads to obesity. Obesity again is a triggering factor for psoriasis. It might lead to diabetes mellitus also. I mean to say diabetes. Yeah. So avoid, a lot of sugar, carbs, oily food, junk food, processed diet. But include like healthy diet like fruit, salad, sprouts, and omega-3 fatty acid rich foods. Like you can add fish, like eggs, like chicken and all. Yeah, that's how it is.
Yes, so the good diet. The youth is more inclined towards, eating junk food and,
Junk foods,
all the things which are good in taste. So I think, as Dr. said, that should be avoided if you are
avoid,
having.
completely. Yeah, and good water intake is also very important. And excessive sunlight exposure is also not advised. Like when they are going on a outdoor holiday or like outdoor trip or something, like they have to apply a broad spectrum sunscreen on all exposed parts of the body at least 20 minutes before going out. Yeah, and excessive sunlight exposure is definitely not, it might aggravate psoriasis.
Okay, so is the sun the triggering factor, one of the triggering factor for
Yeah, to some extent, see, sunlight exposure to some extent it is helpful, because it helps in like reducing the inflammation, reducing the scales, exfoliation, and also it helps in vitamin D3 production, but not excessive UV light exposure is definitely a triggering factor for psoriasis. So they have to protect. Yeah.
Okay, so you have to be protected by the UV rays.
Yeah, UV rays. Yeah.
Okay, so Dr. There is Gaurav, our viewer, asking how do topical medications work for psoriasis, and what are the best practices for applying them?
Yeah, topical medication. There are many topical medications. We start like in creams, ointment bases, lotions, and all. Like we ask the patient to apply, like twice a day on the affected area along with moisturizers. There are many modalities of treatment depending upon again the involvement of the body. Like if the body involvement is less than 20%, only topical medications and like symptomatic management to the medications to reduce the itching and vitamin should be fine. Like topical medications, like just like you have to apply very mild gentle massage till the creams vanishes should be fine along with moisturizers. Yeah.
And the moisturizer and the creams should definitely, be consulted by a dermatologist, not, like any as
Yeah,
you.
not at all. No. Like on counter products or just self medication is definitely not advisable. It might lead to other complications.
Right, doctor. Doctor, we have questions related to food again. That any role of climate or any particular food restrictions in treating it or in psoriasis?
Yeah, climate. Yeah, when it is like dry, cold weathers where there is lack of humidity and lack of sunlight, definitely triggers the psoriasis. And where the people use lot of heaters in their room, where there is lack of humidity, definitely triggers the psoriasis. And food, of course, yeah, foods which are rich in zinc, omega-3 fatty acids, protein-rich food. Like animal proteins and and even veg proteins are equally good. Like protein should be included, and calcium rich food should be included. Yeah, and even we do give supplements for at least 2 to 3 months for better management of rashes. Yeah.
Okay, so a healthy lifestyle can definitely help you and
Definitely, yeah. You should be mindful of what you take. People should be mindful of their lifestyle, like weight management and the diet they take. They should be well educated. Yeah, yeah.
Yes. And doctor, we have already discussed about the various triggers, but there's a question of Jeet asking: are there any triggers that can accelerate psoriasis symptoms, and how can I avoid them?
See, again, like triggering factors, or like as I told you, like any cut or scratch in the skin, or history of trauma in the skin, or like sustained UV light exposure, or an insect bite reaction, or any friction on the skin, like they might get on healing, they might get this psoriatic lesion. So people who have the tendency of developing psoriasis, or if they have a first degree relative of psoriasis, definitely they should be mindful of this, and they should observe like how all these are like healing. While healing, this might convert into psoriasis. Yeah. And any
Okay.
other triggering factors, like if they're exposed to any kind of infections, especially like sore throat, ear infections, or upper respiratory tract infections, like they should approach the doctor, and adequate treatment to decrease the underlying infection is very important. Yeah.
Okay, okay. And we have discussed about the treatment, as you've already told that there are different treatments which are available for
Yeah,
different.
treatments, many treatments are available. And as I told you, it depends upon the severity of the disease also. There are topical medications, there are topical in the sense the applications, ointments, lotions, and other active preparations, which has to be used definitely under a medical supervision. And there are oral tablets also, like, anti-inflammatories and immunomodulators. And nowadays, we have dedicated, like light therapies, which emit this UVB, like UV ultraviolet B radiations. And the most advanced treatment we have is excimer laser. Even I use excimer laser in my clinic, which is really very convenient for the patient to use, and giving very good results.
Okay. And
And
doctor,
very advanced treatment, yeah, sorry, is like these days biological treatments are also available, which are available in the form of oral tablets and also injections. But yeah, it depends upon like one's like economical condition, because they're little expensive. These biologic treatments are little expensive, and they have their own side effects. So depending upon the severity and the we customize the treatments, that's how the dermatologists play a very important role to customize the treatments, yeah, according to the needs of the patients. Yeah.
right. And now, doctor, as you have discussed about the various treatment, but how long, the medications one should definitely take? Because people usually, when they see that, they are getting, their skin is getting good, they leave the treatment in between.
No, no, no. See, that's what, the stopping the treatment abruptly is one of the important, commonest factor for, sudden flare up of the psoriasis, where I see in my office and it is very common in India, like abrupt treatment, abrupt stopping of the treatment is not at all recommended. They have to take regular follow-ups at least every month. Dermatologist visit should be done and followed up very, very strictly, and advices has to be taken seriously and followed. If the disease is mildly involved, mild to moderate psoriasis will take around 6 to 8 weeks to respond, and after that they can come take a follow up, and all the medicines will be stopped. But definitely we like I advise the patients how to maintain their skin and certain like lifestyle and modifications, and that they have to follow. Especially they have to maintain the skin not to become dry, like applying good moisturizers and other things has to be taken care. And if the like psoriasis is involved more than 20-30% of body involvement, then of course, yeah, it takes around somewhere 4 to 6 months to respond. Sometimes they respond in 3 months also, for depending upon how well they follow the advices of the doctor. Yeah.
Right. And so treating it fully is important,
Yeah.
not
It is, of course, yeah, it is treatable fully. We can, like treat the psoriasis. So, but the early and adequate treatment, coming to the doctor, understanding what treatments are required and how much, like, like every follow up of the treatment, lifestyle modification and other dietary factors, everything should be, like a patient should adhere to the advices and the treatment. Then only the treatment outcome will be good. Yeah.
Right, and I think that is very important at treating it well. And as you have already told, it can be cured, it can be treated. So a patient should definitely treat it well and not treat themselves. Doctor, there is a question from a viewer asking: Is psoriasis a hereditary condition, and should I be concerned about my family members developing it?
No, need not be hereditary always. A very, very less chances. Only 5% of the people have the family history. No, it's not, we can't predict like, who gets psoriasis, who doesn't get it. It's like all depend upon the, like, who is affected in their family and all, but need not be, it's like very less chances of family history taken, like.
Right, so it is not hereditary, but
The
you
5%
should.
chances are there. Yes, yes.
So 5% charges are there that it can, go from one person to another. But if they treated it well, I think the
Definitely, yeah,
chances are
yeah. They
less.
can maintain the, yeah, treatment, early and adequate treatment. Watch for the symptoms and take a good, like advice. Definitely, the treatment would be successful. Yeah, they need not worry about the other complications and all. Yes.
Right, doctor. And as we have discussed that, in young people from 20 to 30 years, we can see psoriasis. Is it like that if they're not treated right now, it can occur at the, the next.
Yes, yes, yeah. Psoriasis has this bimodal, age peak. Usually it comes many people like commonly it occurs in 20s and 30s, or it might occur in 50 to 60, fifth and sixth decade. It is like in second and third decade or fifth to sixth decade. It's like that most commonly, and all men, women, children, anybody can be affected.
Okay, so there is no only, age bar that, only youngsters or only,
Yeah, anybody can be affected, but more commonly we see like 20 in 20, the first episode will be like mostly in 20s or 30s or 50s and 60s. It's like that.
okay. And if, somebody is, have psoriasis in the younger age to treat it well, is it possible, it can occur again if they have treated
Can
it well?
occur. Yeah, yeah. It is completely treatable, but yeah, like it can reoccur on certain again aggravating factors, not taking care of their lifestyle, diet, or as I told, all these triggering factors. Not taking care of good skincare also. Well, they should be very careful and keep observing of all these symptoms and approach a doctor and take an early and adequate treatment. That's what I suggest. Yeah.
Right. So treating it properly is the key
Yeah.
for treating psoriasis.
Yeah.
Doctor, how can someone learn more about psoriasis?
See, first of all, you have to confirm, go to your doctor and confirm that is a psoriasis, because lot of other don't self-diagnose. So I always suggest like stay away from this, internet knowledge, go to a doctor, confirm that is psoriasis, because there are all other dry skin conditions which mimic like psoriasis, but only a doctor can diagnose, or there are other investigations to confirm the diagnosis. Then go accordingly, according to the advice of the dermatologist. That's what I say. Yeah. Yeah.
Right.
Because medication and in this internet knowledge, going to your pharmacist, picking up some on-counter product is not, no, they will definitely, they'll end up in complications and aggravating of the psoriasis, and they will go to the complications. Yes.
Right. And actually, the internet has, a lot of information which are available, and people usually,
Yeah, which might be relevant, or which is non-relevant also, or it, like it gives wrong information. Always need not be like correct information. There might be a wrong information also. So doctors are the like best like advisors. Like internet knowledge sometimes is very dangerous. I see a lot of people coming with lot of like other ideas with pictures and all, and they don't know anything about, they get scared of these complications and all. They will be in a very very like mild stages where it can be taken care of very well with only simple creams and simple advices, but they get scared and they get stressed out, which is not required.
Right. And I think when you have a very good dermatologist, why to, afraid of something? Why?
Don't get carried away with wrong information. Yes.
Yes, and go and refer to your dermatologist, because as Dr. Kavitha already said, that it can be treated, cured, and we have discussed about the symptoms, how can be cured. Doctor, before we end this live session, which was very informative, any message you would definitely like to give to our viewers, and any advice also, which would you like to give to the viewers of watching his?
Yeah, see, psoriasis is a common chronic disease where I, like very commonly see in my office, but definitely it is treatable. There is a lot of stigma about psoriasis, feeling that it is contagious, and like no, it is definitely not contagious. It is well treatable. It is a treatable disease, and lifestyle management and dietary modifications and stress management, like one should be aware, or all the people should be aware of the diet and lifestyle modifications, and like triggering factors and all. Definitely, like they can manage the psoriasis very well. There is lot of stigma that it is contagious. No, it is not contagious, and it is definitely treatable. And in early stages, it can be treated within 6 to 8 weeks with a safer preparations. There is no side effects of all these treatments. Yeah.
Yes, so it is not contagious, and don't stick to any stigma that it can, if somebody is having it, you are, far away from that person and not suggesting him or her to go to a dermatologist.
Yeah.
Yes, and I think this has been a very quite valuable session for our viewers. Thank you so much, Dr. Kavitha GV Mandal, for your valuable time.
Thank you
And
so much for the wonderful opportunity to share my knowledge regarding psoriasis. Hope like it helped everybody who has attended this like the session. Yeah.
yes, and it has been a very informative session for our viewers. And I am sure they will definitely use this information to prevent themselves and their near and dear ones from getting
Yeah.
psoriasis.
Thank you.
And
Thank
now,
you. Yeah.
and now they know that if they see any symptoms, they have to go to a dermatologist instead of self-medicating it.
Yeah. Yeah. Correct.
And it is great to hear you, and we really look forward for many more such sessions in the coming time with you for our viewers as well.
Thank you so much. Bye bye. Yeah.
Thank you so much, Doctor. And thank you so much, viewers, for your participation in today's session. And to get latest updates on how to keep your skin healthy, do like and follow our Facebook page. That is All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you, and good day to all.
Thank you, viewers. Thank you. Thank you for your time.